chapter leaders and shop stewards at John George, so he will be emceeing with me.
Thank you, Veronica. Appreciate that. Hello, everybody. Like Veronica said, my name is Ben Fisher. I'm an activity therapist over at John George. I'm also a shop steward and the chapter leader. We are here today with the support of Alameda Health System to advocate for our community, to advocate for our patients, to advocate for healthcare workers. And we are here to send the message that we want hands off Medicaid. We have a great lineup of speakers today, including a few elected officials. We have had a few officials who wanted to show up, who weren't able to come themselves, but they did send some representatives. So we would like to acknowledge them at this point. We have representatives from Congressmember Latifah Simon. Representative from State Senator Jesse Adeguin. And representatives from State Representative Rob Bonta.
Okay, our first speaker, which is a joy and a privilege to have with us here today, I have the privilege to introduce Mayor-elect Barbara Lee.
Thank all of you. First of all, let me thank you for your support and your love and your friendship over the years and your love for Oakland. Thank you so much for what you do each and every day to make sure that Highland Hospital continues to be not only a medical facility, but a place of life, of love, and of caring. And it's because of you that it is this place. And so thank you so much. Because you've known me for many years, and I've always said that health care is a basic human right. It is not an industry. And so what you and what Highland is doing, you're making sure that everyday homeowners folks, people who are working, people who are not working, low-income people who are in shelter, people who need health care, the health care is available, not just for the wealthy in our beautiful city. So I just had to take a moment to thank you all for that, because you're doing remarkable work, you're doing life-saving work, and you're making sure that, our Oakland motto, love life. Love life, and thank you so much. And we're here today to say, hands off of Medicaid. Oakland says hands off of Medicaid. They can't cut $880 billion from Medicaid. We're going to stop them, and we're going to stop them dead in their tracks. We have to make sure, though, that our elected officials, thank goodness we have a great delegation here in California. We have to make sure, though, that some who, and I know this is not partisan, but we have Republican members of Congress, make sure that they join us in saying hands off of Medicaid. Because there is no way that our country should even think about cutting Medicaid, which is a health care framework for care to make sure that people who don't have a lot of money or people for whatever reason have access to quality health care. And so we know what this is about. This is about corporations, it's about wealthy billionaires, and it's about tax cuts. And what do we say here in Oakland? We say, hands off of Medicaid. We're going to be the lead city in saying hands off of Medicaid. We care about people here. We care about their life. We care about their health care. And so I just stopped by today, and I think this is my first rally and first resounding message to Washington, D.C., to Donald Trump, and to the Republicans in Congress, and to everyone to follow our California Democrats, to follow their lead and say no. We're going to fight back. We're going to say no to Medicaid, hands off of Medicaid, and we're going to say no to cutting $880 billion. That's outrageous. It's wrong. It's immoral. It's unethical. It's un-American. Thank you all again. Is Teresa Rutherford, who is our SEIU Central Local President.
Good morning, SEIU. When
what do we do?
Stand up, fight back.
That's not what do we do?
Stand up, fight back.
When communities are under attack, what do we do?
Stand up, fight back.
When Medicaid is under attack, what do we do?
Stand up, fight back.
When kids can't get food at school because of the Medicaid cuts, what do we do?
Stand up, fight back.
When CalFresh is being cut, what do we do?
Stand up, fight back.
When hospitals are being shut down, what do we do?
Stand up, fight back.
Damn right, we are going to fight. We have no choice. $880 billion cut affects not just this generation, not just people who are around now, not just workers now. It affects the future. It affects kids being able to go to college. It affects parents not having health care. It affects parents and families going into bankruptcy because they can't pay the bill after they've gone to the hospital. It affects all of us. None of us escapes this. It shuts down hospitals. In San Francisco, for example, I work at Laguna Honda Hospital. I've been a CNA for over 20 years. And I will tell you that, over 90% of the funding for a Laguna Honda is through Medicaid and Medi-cal. Okay? Where do those patients go if that hospital is shut down? San Francisco General, same thing. Huge amount of funding. This hospital, same thing. So it's not just about healthcare, it's about community. It's about how it impacts every single one of us. A community that is not healthy cannot thrive, okay, cannot grow, cannot build. And we cannot afford for the federal government, Trump and his peons, to prioritize rich folks over the people who work and build this country. Hell no. Hell no. And so we are going to fight. We must fight. We do not have a choice. It is imperative that we fight. It is imperative that we not be afraid. This is our country, and we are going to fight for it. We're going to fight for communities. We're going to fight for kids. We're going to fight for families. We're going to fight for elderly folks who have put their lives and done their job and must be able to, die in dignity, must be able to have good health care, must be able to retire in dignity. We are going to stand up for the community because that's what we do. And so when the community is under attack, what do we do?
Stand up, fight back.
What will we do?
Stand up, fight back.
What must we do?
Stand up, fight back.
Damn straight. And we are going to fight. And you know what? We are going to win. We will win. So let's use this to mobilize ourselves. This meeting now is just the start. We must be on the streets every day. We must be on social media every day. We must preach this gospel of protecting the community because that is imperative. The only way America will be successful is because of diversity, is because of community, is because of immigration, is because of every one of us standing up and fighting and standing for what we believe. Don't be afraid. We stand up, we fight, and we will damn well win.
Yeah.
So we stand up and fight back, and we're going to fight, and we will win. So when communities are under attack, what do we do?
Stand up, fight back.
When communities are under attack, what must we do?
Stand up, fight back.
What will we do?
Stand up, fight back.
And we will win, because when we fight,
We win.
when we fight,
We win.
and we will win. Onward, forward.
That's great. Let's give it up one more time for Teresa Rutherford. I love seeing all the energy that's here today. Next up on our speaker alignment, or in our speaker lineup, excuse me, is a patient and advocate, the lifelong Bay Area resident, former Medicaid recipient, a patient at Highland Hospital, and an advocate for accessibility since the early 2000s. Everybody give it up for Vashti Hayes.
I had to look at my calendar. I left my phone So my name is Vashti Hayes, and I am a lifelong Medicaid user of liver in the Bay Area.
Let's put it
I
this way,
love
I'm
it
thinking
here.
much bigger risk is elsewhere. It's all relative.
I'm here today as a member of HandsOffMedicaid, the domestic employer network, where we organize, employ, and hire domestic workers like nannies, house cleaners, and home care workers to demand dignity and fairness for domestic workers, and to fight for public investment in care for families, people with disabilities, and older adults. As a disabled person living in the East Bay, I speak from personal experience. The critical role that Medicaid has played in my life. Medicaid, or Medi-cal here in California, has provided me with essential equipment like my wheelchair, my hospital bed, and medical care that I rely on every day. These are not luxuries. They are necessities that allow me to maintain my independence and manage my care. Without Medicaid, I would not be able to afford these essential things for my living. But 5 years ago, I was cut from Medicaid. While I now have to rely on private insurance for my job, there are huge gaps in what I can afford. The most glaring is my motorist wheelchair. It's too expensive for me to pay for out of pocket. Without Medicaid support, I find myself stuck. I need to get back on Medicaid to help me pay for my wheelchair and other mobility devices. Unfortunately, navigating the system to get re-enrolled back into Medicaid has been an ongoing struggle. There's too much bureaucracy, too many documents, and not enough support for people like me. And we face real barriers to accessing care. And it's not just about me. It's about all of us. During a particularly difficult time in my life, I was cared for right here at Highland Hospital, which, as you know, is one of the many community hospitals that could be at risk if Medicaid funding is cut. If this hospital has to close to reduce services, it would devastate our community. It's what I received in emergency care and life-saving care here at this hospital. If Medicaid cuts go through, it's not just about losing a program. It's about losing the very resources that allow us to live, to survive, and to thrive. These cuts will put hospitals at risk. Closing doors and leaving vulnerable communities without the care that they need when they need it the most, and we are not alone in this. For people like me, disabled, working, and trying to navigate complex healthcare needs, Medicaid is a lifeline. We cannot afford to lose what we rely on or stay alive, what we rely on to stay alive and well. We need lawmakers to stop the proposed Medicaid cuts and ensure that hospitals like Highland remain open and accessible. We're fighting for hospitals we can count on. Whether we are bringing a baby into this world, dealing with an emergency, or a life-altering disease like cancer. This can't just be, this isn't just an issue for disabled people or elderly people. This issue affects everyone. Okay, man. We all need help, and we all deserve the dignity of receiving the care when we need it the most. So today, I urge lawmakers to listen to their constituents. People like me and people across California who rely on Medicaid to live. We don't need more tax breaks for the wealthy. What we need is a healthcare system that works for everyone. A plan to cut $880 billion from healthcare would not only hurt the wealthy, it would hurt the seniors, the veterans, children, people with disabilities, immigrants, domestic workers, and working families. It's time to protect our healthcare, our hospitals, and our communities. Thank you.
Thank you, Bonta. It's important to remember that we are out here for communities. Next up, however, I'd like to bring out our next speaker, California Attorney General Bonta.
Good afternoon, everybody. How's everybody doing today? I'm honored to be here with all of you. Thank you to Bonta for sharing your very powerful story, and I'm grateful for the opportunity to be here with all of you. As someone whose parents worked for SEIU 1000 for over 50 years combined, serving as dedicated public servants, as someone who is also in SEIU 1021, as an adjunct professor at Mills College, I'm proud to stand here with the purple and gold, and also with all the folks here who are lifting your voices, being loud, being proud, showing up, showing out, speaking up, speaking out. That's what we need. This is what democracy requires. Democracy thrives. Democracy thrives when people are engaged, are participating, are committed, and it dies in the dark when people are silent. So thank you for making our democracy strong. Thank you for speaking up. Thank you for speaking out. And look, this is a critical moment. I believe that our society should be judged on how we treat our most vulnerable, our sick, our children, our seniors, our poor. And what is being proposed by the Republicans in Congress with these cuts to Medicaid, it gets an F- if you want my judgment. It is wrong. It is harmful. There are lives at stake. People will lose access to health care. The quality of health care, prices will go up. Health and life will be put at risk. 15 million Californians on Medi-cal who are being put at risk. Hospitals that we rely on for critical, essential healthcare services could be shuttered. That is not acceptable. And why? Why all these risks and all these cuts? For what? So that a massive tax cut can be given to Trump's billionaire buddies and Elon Musk. Folks who can get their own concierge healthcare wherever they want it, whenever they want it. Who can get a private jet to go anywhere in the world for the specialty care that they need and they deserve, while everyday Americans suffer and don't get the care that we need. So we know it's wrong. We know we have to stand up, speak up, speak out. You're doing that. I thank you for that today. And I want to say this. I'm honored to be the California Attorney General. Right now, three things are really important to our future. And one of my colleagues said this, and I really like it, so I'm going to repeat it. Chris Mays from Arizona. We need courts, we need crowds, we need courage. So when it comes to our courts, we are taking the Trump administration to court each and every time he breaks the law and hurts our people. We We've sued him 22 times in 16 weeks because that's how many times he's broken the law. He's been a repeat offender, violating our Constitution, breaking the law. We have stopped him in court time and time again. We also need crowds like this, the most raw, potent, powerful power that there is people power. Standing up and refusing to accept the unacceptable, refusing to ever normalize what is so abnormal, and pushing back against it. So thank you for being part of those crowds. And we also need folks who show courage, and you show courage, so you're inspiring to me, you give me hope. Some people are acquiescing. Some people are capitulating, are giving up and cutting deals with the Trump administration. When he targets them, he goes after them unlawfully. We need to fight back. We need to push back. We need to fight, because when we fight,
We win.
when we fight,
We win.
I want to say thank you, and I want to end with this. My parents were involved in people power movements, exhibiting the most potent power there is, people power. My parents worked for the United Farmers of America. My dad in the Civil Rights Movement in Selma, Alabama, organizing for voting rights and civil rights. My mom fighting for the restoration of democracy in the Philippines. It took 16 years, but democracy was restored after a dictator took over. And what that showed me is two things. One, we have agency in our future. We have a say. The people will have the first and the last word. The boss of Congress and the boss of the president are not Trump's billionaire buddies or greedy corporations. It is you and me and us, the people. We will have the final word. Our country of, for, by the people. So we have a say, we have the agency. There's a lot of chapters to be written in the story of California, the story of America, and we are going to write it together. The second thing I learned is there's nothing that we can't do if we do it together. Stand side by side, lock arms, no space between us, focused on a common goal. You are here doing that, speaking up, fighting for the future that we deserve. I'm proud to fight with you. Thank you for having me.
All right, everybody, how we doing?
Yeah.
We still got everybody's attention? Yes. Just housekeeping, please be careful of the sidewalk. If you see a patient coming through, please obviously make way. Be careful with the cars, okay? Okay, up next we have Derek Boutte, who is also a member for SEIU 1021, and he is our SEIU 1021 East Bay Vice President.
Good afternoon, AHS. We all already know what we're out here for. We're out here to protect this community and make sure our patients are being able to be served the health care that they deserve. Our job is to also make sure that each and every one of our staff here is being supported in that same unison together. So what we're asking from everybody here is to continue to fight, continue organizing together, and to make sure that we're speaking for this community and to make sure we're holding a voice for our patients. That's our number one purpose, is to make sure that patient care is being given out to each and every one of our patients. I've been working here at this medical facility for 20 years, 20 plus years. For 20 plus years, I understand the effect that this medical facility relies on. I understand that Medicaid is the important purpose for our patient care here. Without Medicaid, this facility will be closing down. This facility will affect our staff that's in here. It's going to make long waits in ER. It's going to shut down areas that may be needed on a consistent basis always. So our number one thing that we want to make sure that we're doing is providing a voice for this community, providing a voice for our patients, and making sure that we're supporting that obligation, that every worker that comes in here every day, their obligation is to make sure that patient care is provided for every patient that enters these doors. So I'm asking that everybody continue this fight, continue understanding that it's going to take all of our voices collectively together to show that solidarity, that we are not going to be pushed around. We are not going to be held back. Patient care is important. Medicare can't be cut, and we're going to stand up for our rights for patient care. So please, when we fight,
We win.
come on, you guys. When we fight,
We win.
when we fight,
We win.
okay, let's continue this fight.
Okay, up next we have Tawanda Gilbert, who is one of our chapter leaders and a shop steward, and she is a mental health specialist at John George.
Hello, everyone. Once again, my name is Tawanda Gilbert. I'm a chapter officer. I have been with AHS for 15 years, and I'm a mental health specialist over at John Joy Psychiatric Hospital, but I am a community advocate for mental health. Mental health matters, okay? So let's just be clear that Medicaid is not a lifeline, right? I mean, it's not a handout, it's a lifeline for all. And for them to sit back and cut Medicaid, I'm recommending the part that will affect mental health, right? And one of the things that people keep forgetting is that all scars are not visible. So we can never put statistics and stats on anything like that. And what I want you guys to understand, that it funds the care that we provide as far as mental health every day. It keeps our clinics open, it supports our jobs, and it helps us heal our patients, the work that we do. But now it's under attack. Cuts, caps, rollbacks, all designed to gut the care for the working class, for our most vulnerable in communities that depend on all of us. All of us. And we say hands off Medicaid, because when they attack Medicaid, they attack our patients, they attack our jobs, they attack our dignity. We fight for care, we fight for justice, and we won't let anyone tear that away. No cuts, no compromise, no silence. Hands off Medicaid!
Well spoken, Tawana. We love the energy. Again, I'm just going to keep pointing out. Look around. This is our community. We are excited to have everybody out here. We got to keep this fight going. Next up, who's going to be speaking for us is a friend of mine, an emergency room nurse at Highland Hospital, as well as the SEIU 1021 Nurse Industry Chair. Ladies and gentlemen, give it up for John Pearson.
Good afternoon, everybody. I'm sorry, Danny. Like Ben said, I'm an ER nurse here at Highland Hospital. I've been an ER nurse for over 10 years here. And like most of my coworkers, I can think of a day recently when I was at work and I was talking to one of my patients who had a life-threatening infection. The doctor said, "You need to stay in the hospital." And there was a decision point for them. We had a conversation that we should never have to have with a patient. They were considering whether or not they should stay in the hospital because they were worried about whether they'd be able to pay for it and whether it would be covered by insurance. No one in the world should have to have those thoughts go through their head. Healthcare is a human right. I want to talk about some nursing basics, something I learned in nursing school. And I think if we all search our memory, we'll remember that we learned these kinds of things in kindergarten, at church, from our parents. And that's that every single person, no matter who they are, no matter where they come from, no matter what they look like, deserves dignity and respect. And in every single developed country in the world, that is something that goes unquestioned. Everybody gets health care, there's no questions asked. You don't have to go to a special place to find out whether you can pay for it or not. Here in the USA, where we have tons of wealth and money, but unfortunately concentrated in only a few hands, we have to ask those questions. Those questions do not afford everyone dignity and respect. They don't afford our patients dignity and respect. And in a place where we pay more per person for health care than most every other country in the world, now we're facing even bigger cuts to what we already have. We're here to take care of our patients and make sure that they get the dignity, the respect, the health care they deserve. And we expect Congress to stand up for the dignity and respect of every single person in this country, no matter who you are. So I hope you'll stand with me and say, hands off Medicaid.
Thank you, John. Well said. I'd like to bring up our final speaker of the afternoon, Dr. Philip Sossenheimer.
Thank you all so much. I could not be more proud to work at Highland out today with all of you out here. And I could not be more proud to be a member of SEIU 10-1. Thank you all for your support and for coming out to protect our patients. I'm not going to mince my words. This administration their threats to cut Medicare are threats of violence against our community. And I don't use those words lightly, but when you're threatening to take away the health care for tens of millions of people, people will die. And where I come from, we call that a threat of violence. And I will not stand by while my patients are threatened to be taken away from the life-saving treatments that they need, from the skilled nursing care that they need. All of us who work at Highland, every day we see the impact that Medicaid has on our patients. I took care of a patient with lupus who spent months in the hospital, paid for by Medicaid, and was able to go home because of the treatment that he received and proposed to his girlfriend. And if if he hadn't had health care, what would have happened to him? If he hadn't had Medicaid, where would he be? I took care of another patient who has dementia, whose wife has been taking care of him, and every day is grieving the slow loss of her husband. And Medicaid was able to fund skilled nursing care for him and allowed her to live a life of independence where she is a wife and not a nurse. If we don't have Medicaid, what do we have? So I want you all to join me in saying, hands off Medicaid.
Hands